So welcome back. So I've done the video on data gathering, data collection, exploratory analysis. So this is the last part of it. So you can watch others. This is the last part. This is on data visualization. Like I normally do, I give my intro at the start and I give a summary of it. Like I say here, 20,000 doctors are working on the research facility, which means that we have more able doctors in Nigeria. Why 20 facility has been suspended, which the government has to verify, make sure those facilities are not operating. I've said that in the exploratory analysis. Okay, so there are higher numbers of beds to contain patients in Lagos than what other places in Nigeria, which makes more sense because there's more population in Lagos than other states. So it's much more reasonable to have more beds there. But I think having more bed again in the Lagos part will also be good because the population of Lagos will increase gradually because increase day by day because more people are coming in for opportunities. And so now you see Lagos has the highest number of doctors than other states in Nigeria, while Ogun has just 69, which is actually sad. And it's actually devastating because how can a state has only 69 doctors? Okay, and I'm sure this facility are more than 69. But I didn't visualize that, but I'm sure it's more than 69 facilities in Ogun State, just having only 69 doctors. That is actually okay. And Lagos has the highest number, which also makes sense. So there are more government allocation in terms of healthcare facility in the north than in the south, which should be considered by the government because this is improportional because most of these facilities in the south are owned by individuals and they set their drug price and everything. So I think the government should also check, trying to build more public facilities in the southern part of Nigeria so that there'll be more proportion, there'll be equal proportion of facilities because most of them are in the north and a few of them are in the south, so that people in the south can also afford healthcare easily. So as a state like Jigawa, Gombe, Taraba, etc. have only one teaching hospital. I've said that also in the exploratory analysis. This is actually bad because if someone have a very serious medical condition, so the person will have to travel abroad or will have to travel, so I have to travel not abroad. So I have to travel to different states or states with higher number of teaching hospitals to get treatment, which is bad. And sometimes the person may not make it because of the distance and the time. Sometimes it may be an urgent, medical care that may be needed. Okay, then next I say Niger has the highest number of medical professionals than other states in Nigeria, followed by Lagos. So I also made mention that I was so sorry that we don't have the data for Benue and Bayelsa. I wish we had that, but where I scraped the data from these two states, the data were not available. So analysis of the doctors in Nigeria. Okay, I was saying this, so just almost the same time. I just made the whole specification, the summary. So it's the same thing. These are suspended. The doctors the government should look after that. Then this is number of doctor, in facilities. This is for the private. And these are for the public. So we see more private facilities than public. So I think the government should also make sure this increases to so that many people can afford it because most government facilities are more affordable than private ones. Okay, so then we have the healthcare facilities and services per state. Okay, this is I highlighted the ones that are needed for so the ones that are higher like this Katsina. This Lagos have the highest bed, which I've saw in the exploratory analysis. So number of facility per state, Lagos again has the Niger has the highest. Yeah, okay. I'll not be reading this. You can. The reason why I put this so that you can also read it yourself. Even though I'm not there to explain it, you can also go through it and read it. Like I'll be posting the link to this story so that you can also read it or from your browser. So go through the visualization too. So this is the same. Map of doctor per state. I've explained this on the exploratory analysis too, even these two. So you can check out the exploratory analysis video. I explain most of this here. So Even this, I explained this too. So this video is just short, just for data visualization. Okay. I know that data visualization doesn't take long to explain, just short explanation. So these two, I explained the two there. So you can also read the notes to understand it more. And finally this, okay, having highest number was in Niger, number of us medical professionals was in Niger, so that is the highest number. So there's not much to explain here. So this will be the end of the project, which is the distribution of healthcare facilities in Nigeria. So thank you all and goodbye.